Hi guys, I want to kind of walk you through one of my favorite treatments, which is full face rejuvenation. So here on my patient, I know we kind of dove pretty quickly into this treatment, but I did prior clean her off, take photos, and then I did ultrasound this area as well. One thing I want you to take note of is that the patient's right piriform aperture area is a little bit wider, and looking back, it's kind of nice to see that because I was assessing capillary refill initially because this is a higher risk area prior to her leaving, just because it made me a little bit nervous. Piriform aperture is a place that I am always ultrasounding just because of how high risk it is. I want to make sure that that artery is not sitting on the bone right where I'm going to be. I hold a really good aspiration and then I inject extremely slowly, and I do about 0.1 at a time. So here I am, I aspirate on every injection. Now I'm giving her a good cheek filler before and after, and I'm just working on her slowly. This is not her first time having cheeks done, but it is her first time with me. So we started off slow, and we were also treating her masseters. So I didn't want to do anything too crazy just because I didn't want to kind of make her feel bulky while we were trying to slim the masseters, but she was very adamant that she needed a little pick-me-up. So I was comfortable doing one syringe and just spacing it out. And we will slowly build with time on this as well. So you can see I'm just aspirating here. I'm making sure that I'm very happy that there's no blood in the hub. I'm on bone. I'm happy with how everything's looking. And this patient was not much of a bleeder, which was very nice because you can really see the before and after result immediately. There wasn't any crazy bruising, there wasn't a lot of bleeding, nothing concerning. So that's always just great to see when you're learning because it's hard to see when there's a big bruise. I also am not, I want to note that I'm not particular on which cheek I kind of opt to go for first, just because it's kind of wherever I'm standing, which oftentimes happens to be on the left side, my left side of the patient. I did start with the piriform aperture though, because my needle was sharp there. So I wanted to just make sure that I had a good aspiration, but you can see I am not injecting quickly in this area at all. The last thing I want to do is put too much pressure in this area and have a cause for concern. So here I am. You can kind of see I'm checking this area a lot. And now that I'm looking back, kind of funny because I was a little concerned about how that looked. But she looked that way before, which is why before and afters are so incredibly important. And I know that I would not let her leave my chair unless I was comfortable with how everything looked. So I just kind of kept assessing it as the treatment went on. I am doing her cheek enhancement on this side now, and you can see how beautiful the other side looks. Her OG curve is perfect. And here I am just kind of injecting slowly, no more than 0.1 at a time, visualizing where I want to inject, where I see, and you can kind of see how quickly one syringe of filler goes. I mean, it's really not a lot of filler at the end of the day. And knowing that and telling your patient that she is not going to leave the clinic looking like a different person today with one syringe of filler is super important to kind of set those realistic expectations. So I'm just kind of working my way around her face, making sure that I'm very happy with everything. And she was incredibly satisfied at the end. Of course, she wants more, but that's something that we'll build on, especially after those masseters slim, and that's normally about 4 to 6 weeks later. So you can see I'm just being strategic. She did get a beautiful result with just one syringe, but it is pretty rare for that to happen just because it's a blueberry and we treated multiple areas of her face. So you just want to be careful with that. And this is about my last injection here. We teach the cheek filler and cheek enhancement in our level 2 dermal filler course, but we teach piriform aperture and using ultrasound in our level 3 course, just because it is a little bit of a higher risk area. So I am just checking cap refill, showing the patient, massaging some arnica all over and making sure that I'm happy with how she looks prior to letting her leave. And I am super happy and felt comfortable having her go home. You can see there I am just squeezing, and she does have a little bit of a tan and some areas of her face are pinker, so I'm just checking everything. Thanks for watching.